Hello everyone, this is Dr. Manoj and myself, anatomy faculty. Today I am here to teach you some new topic regarding head and neck. So we shall start with scalp. Scalp is one of the most important topic, which is like clinically oriented questions for NEET, PG and FMG examinations. So let's start scalp with, first of all we shall see the extent of scalp. Under the scalp, what is the extent of scalp? From where does it extend and to where? Generally you can write down as scalp is anteriorly, it starts from the superciliary lines. Superciliary lines. And coming to the posterior side, what about on the posterior side? Posterior side, it starts at superior nuchal lines on the posterior side. So if you can see this picture, you can appreciate that. See, these are the superciliary lines, okay, on the anterior side on the both sides. And coming to the posterior side, this is the superior nuchal line, right? This one is the superior nuchal line. I can write it here as superior nuchal line. Okay, just below the superior nuchal line, you also have inferior nuchal line. This is a inferior nuchal line. Okay, and in between the superior nuchal line and inferior nuchal line, this is the median nuchal line, right? This is the medial nuchal line. And what about this one? Which one is with the green color, where I am drawing with blue? This is the external occipital protuberance. Okay, but the scalp is attached until the superior nuchal line only, right? And yeah, moving on to the next thing. If you see on lateral sides, where does it is attached? On the lateral side, it is attached to the superior temporal line. Superior temporal line. So this is the superior temporal line. Okay, so this is the extent of the scalp, and we shall see the layers of the scalp now. Coming to the layers of the scalp, how many layers of the scalp are present? There are 5 layers of scalp, and that is represented by S, C, A, L, P. So coming to the first one, what do you mean by S? S is the skin. Everyone knows that S is skin, right? And coming to C, it is connective tissue. And you can also call it as, this is the superficial fascia. Okay, and coming to A, it is the aponeurosis. Okay, and coming to L, it is loose areolar connective tissue. Okay, and yeah, see, this one is called as the dangerous area of the scalp. Dangerous area of scalp. And coming to the P is nothing but the pericranium. The word itself says the pericranium. Pericranium is exactly just above the cranium, that is the skull. And we shall see the details of each and every layer. Moving on to the next thing, we shall see the first layer now. Coming to the first layer is nothing but skin. What is the importance of skin of scalp? See, this is the most common. This is the most common site for sebaceous cyst. Okay, and how does this be? This is like thick and hairy. Okay, as it extends onto your forehead, but the forehead doesn't have hair except forehead, right? So moving on to the next layer, what is the next layer? Next layer is the connective tissue layer. Connective tissue layer. And this connective tissue layer is nothing but, this is the dense connective tissue layer. This is dense. Okay, and what do you have in this dense connective tissue layer? In this dense connective tissue layer, you have blood vessels and nerves. Okay, and these blood vessels come into from the periphery. Okay, and here there is one more very important feature is there, that is, there are some small pockets present in this layer, and these pockets contain fat in them, and these are also called as fat pockets. Okay, and inside each packet, not only fat, you also have blood vessels and also nerves coming from the periphery. So the most important clinical thing here is, see, if any person is injured or hit with a rod or any stick, so what happens? If the second layer of the scalp is injured, there will be profuse bleeding. Okay, why there will be profuse bleeding? That is the important point. See, the upper layer, let's consider this is the upper layer and this is the lower layer, and in this there is a blood vessel. See, the blood vessel is adhered on either sides, and this will not allow the blood vessel to retract or constrict. So that is why whenever there is any injury here, there is lot of blood flowing from this, and there will be profuse bleeding. Okay, and this can be stopped by how? And what is the treatment for this? This is pressure bandage. Okay, and not only this, this layer is connected to your intracranial dural venous sinuses. Okay, this is connected to intracranial dural venous sinuses by what? They are called as emissary veins. Okay, emissary veins are connected from intracranial dural venous sinuses to the second layer vessels. Okay, now moving on to the next thing. Before moving, in the second layer there is one more most important thing. You can call it as, there is a condition called as caput succedaneum. What do you mean by caput succedaneum? This caput succedaneum is nothing but, this is if there is any injury to emissary vein in second layer of the scalp, it leads to caput succedaneum. I can show you a picture here of caput succedaneum. Yeah, if you can see this clearly. Yeah, this is the second layer, right? In the second layer, whenever there is bleeding and there is hemorrhage, this condition is called as caput succedaneum. And here, whenever there is hemorrhage, if you can press the hemorrhage, that is movable. Okay, you can remember one more important point, that here the hemorrhage is slightly movable. Okay, and coming on to the third layer. What is the third layer? The third layer is aponeurosis. Aponeurosis. Okay, this aponeurosis is nothing but, this is formed by two muscles in the front and two muscles in the back. What are those two muscles in the front? The two muscles in the front are nothing but frontalis in the front and occipitalis on the posterior side. You can see in this picture, yes, see these are 1 and 2 frontal bellies, and these are 1 and 2 occipital bellies. So this overall, this muscle is called as occipitofrontalis. Okay, and there are these two muscles, and posterior two muscles are connected by a aponeurosis, and that aponeurosis is called as galea aponeurotica. Okay, what do you mean by galea? Galea is nothing but, galea is helmet. So it covers the skull just like a helmet, and it protects the skull like a helmet. So that is why it is called as galea aponeurotica. Fine. And yeah, you can appreciate this galea aponeurotica here in this picture. See this part is the galea aponeurotica. See, and there is one more important thing here. If there is any cut in this galea aponeurotica, what happens? See, if there is, we can cut it in two ways, like if it is like horizontal cut, or if it is like transverse cut. So whenever there is any transverse cut, because of the pulling of frontalis from front and pulling of occipitalis from behind, this will not gape. That means it will not give any gap. Okay, whenever there is anything horizontal cut, because these are pulling from either sides, there will be gaping. Moving on to the fourth layer. The fourth layer is loose areolar tissue. Okay, this layer is also called as dangerous area of scalp. Right, this layer is also called as dangerous area of the scalp. Why this is also called dangerous area of the scalp? Because see, in this layer also there are emissary veins. Okay, whenever there is any infection and any pus kind of thing here, the pus will pass into intracranial sinuses. That is why this is called as dangerous area of the scalp. And here, see, this is also called as surgical layer of scalp, because during craniotomies, this layer is mostly used in craniotomies. Okay, craniotomies, this layer is mostly used to do flaps. And moving on to the last layer, that is pericranium. Pericranium. What do you mean by pericranium? Pericranium is nothing but, it is above the cranium, that is above the skull. Let's say, see, this is a schematic diagram of skull. In the skull you have sutures, right, between the bones. So let's say these are the sutures. Okay, what happens to this pericranium is, the pericranium covers the outer table of the skull, and it also enters the suture and it covers the inner table. Okay, in this way there is pericranium present. So whenever there is any hemorrhage in this pericranial layer, what happens? The hemorrhage will be inside here, right? Something like this. So this condition is called as cephalhematoma. Cephalhematoma, and here the hemorrhage will not move. This is immobile. Okay, I can show you the picture. Yeah, you can see this. See, over the periosteum, these dotted lines represent the periosteum or pericranium. Okay, and see, this is the cephalhematoma, right? Yeah, and there is one more condition called as black eye. What do you mean by black eye? Black eye is nothing but, see, this is subgaleal hemorrhage, because whatever there is, if there is any hemorrhage just below the galea aponeurotica, the blood seeps from the galea aponeurotica onto the anterior side. So if the blood seeps onto the anterior side, see, these galea aponeurotica are attached to the superior ciliary lines, but there is no bony attachment actually for these muscles. So the blood seeps into the eyelids. So whenever there is periorbital hemorrhage, you can suspect that there is any cranial injury or there is any injury to the scalp. So you can find black eye in subgaleal hemorrhages. Okay, and not only that, there is one more condition called as raccoon eyes. What do you mean by raccoon eyes, and what is the difference between black eye and raccoon eyes? Black eye is nothing but, this is always unilateral, and raccoon eyes are also nothing but, this is also periorbital hemorrhage, but this is on both the sides, that is bilateral, right? I can also show you the picture there. Yeah, see, this is the black eye. Okay, and coming to raccoon eyes, see here the patient is having periorbital hemorrhage on both the sides. So this condition is called as raccoon eye. Okay, with this we have finished the clinical anatomy of scalp and also the general anatomy of the scalp, and we have also seen the extent of the scalp. There may be definitely a question from this, and this is very important topic. Thank you very much. We shall see the sensory supply and also the blood supply of the scalp in my later videos. Thank you very much.